What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. In today's video, we're going to give you helpful tips and advice to land your job after your X-ray clinicals. Or as you're going into clinicals, if there's a certain place maybe it's close to the house, maybe you like the workflow, the environment. So, give you some context. I am X-ray tech. Push the button at nighttime at a trauma 3 ER level center. And where I work at currently, it is, as a student, that's where I wanted to land my job at. It was my first clinical site, and since the very first day I fell in love with it. It was perfect. It was literally 3 minutes from my house. I enjoyed the managers, the people who work there, the veteran techs who've been there 20 plus years, the staple of the company. Everything was good. I enjoyed the workflow. It wasn't too much. It was right in the middle. So how did I go by securing said thing? Because I wasn't the smartest, but what I did have was the commitment, a work mentality that the employees are looking for. So I would say that the biggest thing that separated, and I even got told by the manager who hired me post board exam, she was like, Miguel, we hired you because out of all the students, both first year and second year and prior years, you were the only one who came in just a little bit early, not that much, 5 to 10 minutes early. You got there, got your stuff ready, saw what needed to be done, prepped, or did a little clean, or you were always doing the little things to help us and make our jobs a little bit more easier and make the workflow better. It's that single thing puts you leaps ahead of other people. Because other people would come in there and they're like, well, that's not X-ray stuff. I don't have to do it. Even though it did pertain to the X-ray stuff, but not the actual same. Or even with the comps and the checkoffs and stuff. It's regardless if you already got your checkoffs or if you already did your stuff you needed, you would get out there. You were a team player. If you didn't know, you'd grab someone and try to get them to help you so you can learn. And you'd always be like, well, I don't know, but I can learn today. That was your signature quote you would say when you didn't know. Or I'll do it, but just show me. You were a go-getter. You were it's very optimal compared to other students who would be well, I'd rather just here chill and not do it. So you were very focused on that, and that helped a lot. And also being very consistent at clinicals. Obviously there's an emergency, or if you're sick, it's different, but there's some people who would just call in just to call in, or they would be missing a lot of days, or they wouldn't get along with the people that worked up there. That's another big thing. If you, for some reason, you don't click good with the squad that's currently working, because what happens is they congregate and they say, oh, we're hiring so-and-so. What do you think? And they'll be like, he did a good job. Oh, yeah, he'll be a good asset to the team. If they were not that good, then they're like, nah, I don't think it'd be good. Because if you end up messing up with the people who actually work there, and you don't really, you were kind of slacking, they feel well, if we hired him, yeah, he'll get paid, maybe he'll be motivated a little, but we don't know that. We can never taking a risk type deal, so that helps a lot. Me, in general, I'm very neutral. I'm very antisocial and hermit crab type. So I'm very fluid amongst the congregation of X-ray up here. I get along with everyone. I tend not to get into drama or anything. I just go in there and get the job done type deal. So, regardless of if you're if someone's slacking, I mean, people have bad days. People have good days. People sick or have other stuff going on. But how I see it is when I go in there to do my job, whatever is going on out here in the real world, turn that off. My goal is to get the best pictures possible. And because some of my pages, you'll go in there and yeah, maybe you're worried about some like simple things or some like incident, and then you have someone with like a broken leg with some crazy, like way worse condition. It makes you reflect on, my life ain't that bad. Whatever's stressing you ain't that bad. Like, because these people, like, it's different. So, like, even now, as a tech, when I'm working, like, if we have a few techs that aren't the most, I guess, can't keep up with the pace as much, so they'll tend to put them in different sections of the hospital to their workflow. So, if I get caught up working with someone who's not as fast-paced as I am, or I will always, regardless of who it is maybe it's not the best thing, but I'll always rather to carry the workflow on my shoulders and just take care of the job to get ahead, because I will literally sometimes will be there, we'll be fine, we'll be caught up, and I'll take my lunch break, and then it's just like everything just gets slammed. They fall behind, or they don't go do stuff as fast or as I don't know what happens. And I'm like, I'll just be staring at the screen and it'll just be like, and I'm like, God damn. So I have to like cut my lunch break short, come back in there and just like catch everyone back up. And they know, they'll literally be there like, oh, well, thank God, Miguel, that you helped us, you caught us back up. Cause like we were struggling and we were like, and I was like, which that I know that's not really optimal to be doing that kind of stuff. But what it does notice is the manager. The manager already paid attention and sees that I'm a very good player, and that got you a raise because they know you do a good job and you do it. So yeah. And with me personally, I have a very hard time getting jobs. I don't know why. I'm a very hard worker, but so I tend to do everything possible to keep the job I have because it's the job I always wanted. And it's very good. So if there's something like that at your clinical site that you want, maybe they don't have any openings. Like when I got out of school, the place I wanted didn't have any openings. They were fully staffed. But the manager was like, look, something happens, first one to call. And I was like, okay. And then they're like, okay, there's a PRN position open if you would like. And I was like, okay, well, let me pass my board, whatever. And then on the day of me getting hired, they're like, look, someone just put in their 2 weeks for a full-time gig here at night. Do you want it? And I was like, landed on my plate. And I was like, this is what I wanted. Like, and everything worked out. So if you like something, go do it. Should be. And I know not everyone will land their dream job, because even amongst my peers and even people who I work with, and they tell me how shitty other jobs are and how they got paid less money to do more work, or like the working conditions, which blows my mind to this day. And I'm like, I'm thankful that I didn't have to go through that and I automatically landed a good job. So, because there's other people who, especially PRNs will tell us about other places and how they be working, and how we have techs here who come an hour to 45 minutes away just to come work at my facility. And it mind blows me. I'm like, is there no other jobs? He's like, Miguel, some of these places ain't that good. He's like, here, I love it. It's amazing. I'd rather come here and drive. And I'm like, wow. I'm blessed. So I guess my biggest advice is, when you're a student, act like you're getting paid. Even though I know you're not getting paid and it sucks and you have a bunch of stuff going on, act like you're getting paid and do as much work as possible you can. I know you can't do everything as a certified tech, but you can do try to do as much as you can. Because even though the manager didn't see it, even though the assistant manager didn't see it, the actual techs in your section, if you do it day after day after day, consistently, that will somehow end up conversations with the big people and, hopefully land you your job. And because right now with this economy, I ain't going to say you're going to live a rich life being an X-ray tech, but you can live a decent life. And it can be your foundation to whatever other stuff you want to pursue. I would say that it can open your doors to maybe if you want to do CT or other radiology stuff. Or worst case, just use this to fulfill your dreams and goals, like put money towards those. And have it as a safety net, because I'm be honest with you, I don't see this profession, at least within our lifetime of the next 100 years, going away. It might advance to get to, but I don't think in my lifetime we will be run out of a job. Yeah, we might become more like robotic type stuff might come into play, and you might have to continue your education and stuff, but I don't think the whole AI stuff would completely dominate our field. Even though my lady will bring it up sometimes and thinks that robots, because I'm like, look, you can program a robot to do so much things, but when someone's in pain and someone's hurting, are the robots, because they're programmed, are they able to comprehend, show emotion, show compassion towards someone in their time of need? That's very different. I can see maybe in like 2-3 generations worth, like when I'm dead, maybe it could get more robotic and us not do as much. But at the current time, it is a good profession for anyone here. So yeah, it's been your boy Miguel. Hope you enjoyed these videos. I don't mean to put no one down. I just give the honest advice. I don't get paid to do this. I'm just literally giving back to the community. And I will continue doing these very niche topics because, once again, as a student or even prior to that, I've always had many questions. And on the YouTubes, there was only videos from like 2007, 9, whatever, like old crusty videos of people just, X-ray, like it was very bland. So I try to go in very niche topics to give you very specific details and hopefully give you a better insight of what it is to be an X-ray tech. Because it's more than just it's more than that. It goes deeper. But sometimes, I ain't gonna lie, sometimes there'll be like trauma. This is some extra shit. But like sometimes there'll be traumas and stuff. And you'll go in there. You'll see the nurses doing everything. And then you just come in, take your shot. And the doctor's like, here's the problem. And you feel like a gangster. I ain't even gonna lie. You're like, here, did my 30 seconds of work. Saved your life, sir. And then you're just like, Feels pretty gangster, I ain't gonna lie. Because sometimes they're like, hurry up, Xray, can you do it? And then you do it, and you get it on the first shot, and you feel very gangster. Especially in like a trauma, real life trauma, like a life or death, and you get it on that first shot, money, like, ain't nothing like it. And yeah, it's been your boy Miguel. See ya on the next one.